Okay, our next comment is from Laurel.
Uh, Good afternoon. Uh, we keep running into the problem. We don't have enough time. So if you're going to have one committee and two topics like this, you're going to have to, well, would you please consider making the meetings 2.5 or 3 hours? Let's be realistic. Otherwise, your promise to have interactions uh, isn't going to be fulfilled. And I know your intention is to do well.
Laurel, I appreciate you, and my hands were tied, and I wanted to make sure I uplifted two commitments: the commitments to talk about the structured, and to make sure that the people that are losing their services and their jobs, and it was my decision, and you're 1,000,000,000% correct, but I literally had to get this information out, and I understand you, and I don't know what the legal rights are because there's so many rules, but I'm sure we'll find out if we can make these meetings or not. But I feel like I got to get a lawyer to have a lawyer to have a lawyer to figure out all this. But next comment.
Well, if I could just finish.
Okay,
we
go
have
ahead.
a saying, sabr is patience in Arabic, but it's assertive patience, and you certainly are assertively patient, and thank you.
Oh,
So I just wanted to say I want to support the peers who have spoken representing their organizations and reporting what's going on. It's very painful. Evaluation, ongoing evaluation, I don't know where that is in Prop 1. It was so long, it's hard to remember. And we didn't all vote for it. It only won by a sliver. So my feeling is that you've got to go to the press, you've got to get out and get your voices heard uh, in many, many ways, many active ways. Go back and consult the ways people can be actively nonviolent, and and report on what happens. Just keep it going so that people will the powers that be will listen, and let's hope for a new governor who does better in this area at least.
We'll keep reporting, Laurel. You keep showing up, okay? You keep showing up. Go ahead.
Inshallah.
All right, our next comment is from Steve.
Good afternoon, everyone. My name is Steve Hazen. I am a proud staff member of Peers Envisioning and Engaging in Recovery Services. Um, and I know that a lot has been said for, what the cuts from BHSA and Prop 1 are going to do to organizations like ours, like Peers. And I just, I want to say that in the course of the time that I have been part of Peers for almost 5 years, I have seen not just the powerful and important ways that we've directly impacted people, but also the way that we've been able to be a lifeline and a support for people even before crisis would even be considered or a thought for them. And I think that losing places and organizations like Peers that are so vital and so important and valuable to people really is going to have an impact that I don't think the state's ready to see.
Thank you, Steve. I really appreciate you getting up here and telling your story. I hope to see you more.
Our next comment is from Michael.
Hi, my name is Michael Lim, and I currently serve on the Behavioral Commission in San Mateo County. I'm also a certified peer support specialist. My comment is that, I just want to remind everyone that we are in the business of helping our clients recover and heal, right? And this act of moving the funds to Sacramento is all about, to me, efficiency of how money is being spent. And as we know, prevention is all about communication, right? We all know that whatever message is transmitted does not equal to message and services received by the client. And what is the gap there? The gap is differences in culture and differences in trust, right? And we all know that 58 counties makeup can be very, very different. And recovery only happens at the speed of trust. And if we don't have trust there, why are we spending money and services in a way that is not effective? And so I just want to, remind everybody that we are in the business of helping people heal and helping people recover. Thank you.
Thank you, Michael.
Next, our next comment is from Javier.
Hi, so I just want to say there's three things I would like to mention is like since Prop 1 was all about housing and everything, is like where's that building? Where's the housing? I want to know like where that money's at, where it's going, how it's being utilized, and what houses are being built, because I don't see no houses being built. The second thing is I would like mass email with everybody that's been up on here. So we're able to connect, we're able to communicate. Everybody that 100, 200 people that were here, we all deserve to be connected together because we are the community. And number three is, y'all already took our money. Like, don't take away our voices. Like, y'all already got the bag. Like, I feel like this is already something that's already set in stone. If y'all gonna close the programs, it's already closed. But don't take away the people's voices. And it's just ridiculous that the one chance that you have to have everybody here to say something and y'all just want to shut it down. Like, it's not right. It's not right. I understand the whole legal like stuff, but like there's hoops you got to jump through. But then again, like I respect that. But thank you.
Thank you. Our next comment.
Thank you, Javier.
Our next comment is from Grace.
Hi, Rachel. Good to see you today. My name is Grace Gallagher. I'm the education coordinator with Cal Voices Access California program. I have a very in-depth public comment that I will be emailing. Please, I urge you to read it. And I'm speaking on behalf of hundreds of peers that we have trained statewide and all of their concerns that they have shared with us. It's heartbreaking. So please take our feedback. And if you were not able to share your concerns today, please email, put it in writing. Thank you.
Thank you, Grace. Our next comment is Kimberly.
Hi, my name is Kimberly Marquez Cortez, and I'm here to just reiterate strong support for peer support services and highlight what was already said in terms of peer support is not prevention. It's both intervention and early intervention. Peers use their lived experience to engage people early, de-escalate crisis, reduce hospitalizations, and increase retention and services. This is evidence-informed, cost-effective care that strengthens long-term recovery. We build trust that the traditional system often cannot, especially within LGBTQ plus and BIPOC communities where historical harm and systemic inequities create barriers to engagement. And we serve as culturally grounded bridges to support folks. Layoffs and reductions to peer roles, as you've already heard, will disproportionately harm these communities because when peers are removed, trust is disrupted, engagement declines, and disparities widen. And the very people that were once providers will also now be possibly needing some of these services because
That part, Kimberly, that part.
And if we truly value lived experience, equity, and community inclusion, we must invest in sustainable funding, equitable pay, career pathways, and meaningful leadership roles for peers. And lived experience is expertise. Peer support is essential to a responsive and equitable behavioral healthcare system. Thank you.
Kimberly.
Sorry, go ahead, Rachel.
No, I just wanted to note that I know Kimberly and their organizations also are going through layoffs, and I'm happy that you guys can still get up here and do this. You can go ahead, Mariani.
Okay. Our next comment is from Pinky.
Thank you. My name is Pinky. I am an activist here in Sacramento County. I sit on several boards. I'm deeply upset and disheartened as someone who's dedicated my entire life to healing, growing, and using my lived experience to lift others up. And becoming a certified peer is not just a goal, but it's my calling. Peer work is what drives me and grounds me my every day and gives me purpose to everything I have and from what I've survived. Hearing that peer positions may be cut or being cut makes me feel hopeless and unseen. Our voices matter, our work saves lives, and losing the roles would be devastating, not only for me, but people like me who are fighting to step into this work with passion and purpose. It's sad. Thank you.
Pinky, I'm standing with you. I'm standing with you. Please continue to show up. We're not giving up.
Thank you. Our next comment is from Carnella.
Hi. Once again, I'm hearing about the cuts constantly, and so we know they're going to happen. And so I think we, as a people that stand for peer support, should maybe focus on funding to possibly put in the budget. I wanted to also say, even though they're merging the committees, is there the opportunity to create subcommittees under the one committee?
Can ask. I'm pretty sure at this point we have to ask. So we'll ask, and that's a good idea.
Our next comment is from Ben.
Hi, good afternoon. My name is Ben Renteria. I'm a director of a SUD outpatient network of care in the greater Sacramento area. The reason I got into this field in the first place was basically driven from I lost my older brother to a heroin overdose many years ago, and that affected me, and I wanted to do something to help save other people like my brother. And I just wanted to spread awareness about a model of care called the Certified Community Behavioral Health Clinic, CCBHC model, which is a national model of care that requires clinics to provide peer support services. It's one of the required services that a CCBHC must provide. In California, there's around 27 CCBHCs, but they're sustained on federal grants. The state of California did get a state planning grant back in 2016, which indicated that they did have some plan on implementing the CCBHC model. And the Bipartisan Safer Communities Act that was passed at the federal level gives states the opportunity to join that demonstration at the federal level every 2 years. This year, the state does have the opportunity to join the federal demonstration for CCBHCs. And CCBHCs have an additional layer of protection from cuts because they're codified into law through the Bipartisan Safer Communities Act. And the state can also join the CCBHC model through an 1115 waiver like Texas did, which would work better for which works better for Texas's unique managed care infrastructure. California can do the same thing, and I just want to spread awareness of that model.
Can you send this by email? I mean, I wrote it down because I'm hearing about this, but Mariani, can you state the email again? Because this was good. I wrote it down, and I've been hearing a lot about this, but we can forward this to the state as well, DHCS. Mariani, what's the email again?
Yes, you can send a longer written public comment to publiccomment@bhsoac.ca.gov. Public comment at B as in boy, H as in Henry, S as in Sam, OA, C as in cat, .ca.gov.
Got it. I will do that. Thank you very much.
Thank you, Ben.
Our next comment is going to be from Joel.
Hey, thank you so much. I apologize for not having been able to make the entire meeting today, but I just really wanted to probably add my voice to the chorus of voices concerned about the combination of the committees. I feel like as we think about the very real challenges that we're examining in each domain, the idea of having less opportunity to speak with one another in a very specific way is problematic. And so I just really want to make a pitch for if we're forced to keep these committees combined, which it may very well be, that we get very creative about making sure the salient issues that occur within each particular area are really being grappled with seriously. This is not a time for us to be having less conversation and less discourse about very, very specific and real experiences. And so I'm just very much hoping we can look at how that's structured. So thank you.
Yeah, like I mentioned, Joel, like we had to have the conversation. So time was strapped anyway. And I felt it was the great urgency with the amount of culturally and linguistically identified folks that are about to get laid off and individuals that are going to lose their services, which is why I packed this in. But I will be more intentional and work with the vice chair of this. And if it doesn't work out, we'll be intentional. But this is why we're doing it. And I believe that I did my best. I appreciate your feedback.
Yeah, and I just want to echo your passion and care for the people doing this work is so 100% obvious. So this in no way is a criticism. I just know this was on the agenda today, at least initially, and I just want to keep raising it because we see what's happening as communities are being erased everywhere, right? And so we don't want to contribute to the erasure in any way possible. But please just hear this as more of a pitch, a plea to the world. Yeah,
I hear you, and that's gonna keep me accountable. I think we got one more last comment, right, Mariani?
Yes, we have one more comment from Jana. Go ahead.
Hi, this is really short. Rachel, I just want to thank you for allowing and insisting on this listening period happening. Katera, your comments about never hearing something like this before, I think are really important. And I just appreciate your leadership to hear all these voices. So we know of what has happened and the milk has already been spilled. I wonder how much we can advocate for technical assistance for the peer runs, for fundraising. We need to know, I mean, one of the main principles of finance and budget is diversification. And in a sense, we were spoiled by MHSA, and I think people got comfortable with it. Has there ever been enough? No, there's always going to need to be enough. We deserve enough. We do the work. In the meantime, however, how do we move forward? I would like to see technical assistance in development and fundraising so that people can begin to get income from sources other than the state and Medi-Cal. And I would like to see that for the peer runs. I'm not sure exactly how or where.
I think that's a good, I mean, Painted Brain saw the writing on the wall a long time ago. And I think that there's a lot to be happening. I think we should talk about that because there were efforts that were made by the state. Do I think that they were as coordinated as some other efforts? So I think that'll be another conversation. I wrote that down as my notes, and those are things that I definitely would like to share as another CEO. I think there needs to be some listening sessions, some collaborations. I mean, I just wrote an article in the LA Voyage about people probably needing to consolidate and to share like financing strategies. So yeah, I have a lot of ideas, and I want to say I appreciate you, Jenna. Was there any other public comments or just listening comments since this isn't an official session?
At this time, we do not, and we do actually have to end as we have another meeting coming up.
All right.
But we can keep taking more written public comment via email. And I believe that staff is also going to try to organize another listening session on this matter.
All right. Well, thank you for your time, and this listening session is adjourned. Thank you.
Thank you, Chair Chambers. We appreciate you.